I said the Morrison government's plans depend a lot on Australians behaving well. Let me hone in on the particular issue, the most important one. Can we rely on people to really stay at home if they test positive and are told to self-isolate? Last week, and true, I'm talking here actually about a British tourist, she tested positive, was told to self-isolate in Sydney. Instead, she caught a plane and went to Hamilton Island. I was joined a short while ago by Professor Dale Fisher. He's a Singapore-based chairman of the World Health Organization's Global Outbreak Alert and Response Network. Dale Fisher, thank you so much for joining us. Australia's chosen not to impose a lockdown like we see in France and Italy. There's going to be no ban on non-essential travel from home. We're not going to be closing schools. We're not going to be sending people into mandatory quarantine centres. Your verdict?
Thanks, Andrew. I'm certainly not here to judge what countries do or don't do. I can talk about what's been done in countries that have successfully contained it so far, and I do mean so far. Perhaps Korea is a good place to look at from an Australian point of view, who obviously did have thousands of cases. They also didn't do a lockdown, but what they did do is the whole bundle of activities that are important in managing COVID-19. They put them all in place and did them very well and very vigorously. The bundle includes where you keep your cases, and as you know, I'm an advocate for taking cases out of community. But of course, if you can guarantee that those cases aren't causing any spread, then that's the same thing. Certainly in China, Singapore, Hong Kong, and Korea, that attitude wasn't taken. That it was safer just to take those people out until they were clear. So I'm not sure what measures Australia's putting in place to make sure that those people aren't spreading it. But if that's successful, then that's the same outcome. Korea did close schools, but they're reopening them again very soon. Singapore hasn't closed schools, so I think it's quite reasonable to justify non-school closures. So really, it's about any country putting in that bundle of interventions, which is the case management so that it doesn't spread, management of contacts. How to quarantine those, how to identify them quickly, making sure that testing is freely available, and making sure that the community engagement's there so that the messaging is consistent and clear and people know their role in the outbreak.
Can I take you back to that point about taking cases out of the community? Now, a number of places tried actually sending them, anyone who was infected, sending them to a centre where they would be basically locked away from the rest of the community. Australia's gone, well, let's put them, they've got to stay at home. But there's a slight difference between Australia, it seems to me, and the countries that have been most successful in stopping the spread, like Singapore, Taiwan, Japan, South Korea. There, it seems to me, very, very tough monitoring of where people are at any one time, and also more of a culture of obedience to government, which is not necessarily always a good thing, but in this case ensures more people do stay at home. Is that your worry too, that we may not be up to that challenge?
Look, the cultures are obviously completely different, and that calls for a different response and different challenges. When people talk to me about sort of the draconian measures and authoritarian states and things like that, I say we're still open, and half of Europe, they're all inside their houses with their borders closed and their businesses shut down. So there is an inherent threat with the freedom that people are used to enjoying. And I think in Asia that does make it a little bit easier, I guess, in terms of compliance with government requests. And
the difficulty for some people here in Australia, Dale, is You know, we've had only 6 deaths in Australia, and we're seeing this enormous dislocation to business, thousands and thousands of people losing their jobs. And some people will be saying, well, why all this pain when we've only had 6 deaths? Your response?
So the typical mortality from this this disease is 1% or even a little bit less. The problem is when your health system gets overwhelmed, and what we're seeing in Italy is a case fatality rate of around 6 or 7%. So this is because, you know, they're simply out of ventilators, out of beds. Doctors and nurses are exhausted. So you know, the death rate in Australia, to be crude, you know, is about right. If we're saying 6 out of 400, Singapore is 0 out of 260, but you know, they're small numbers. That could change, but you can see we're all hovering around the 1% mark, and that's because the numbers are still small. The danger is that that when those numbers get big, you can see a lot of people dying, and it's yes, it's the elderly, yes, it's people with comorbidities, but it's not invariably those people. You know, and it can be devastating from a health and mortality point of view if it's not kept in check.
And of course, for the old people themselves, they may be old, but they still want to live. Dale Fisher, thank you so much indeed for your time.